Hi, I'm Dr. Saji Kumar. Happy to be here. You know, over thousands of years, Ayurveda has helped many to enjoy a healthy lifestyle. It's a great honor to address all our brothers and sisters of India on this great day that is being observed as National Ayurveda Day, the very first National Ayurveda Day. For those who are practitioners like us and beneficiaries of Ayurveda, this is a great day of celebration of very traditional lifestyle called Ayurveda. This year's Ayurveda is observed with the theme Ayurveda for Prevention and Control of Diabetes. We have launched a very good logo on behalf of this Ayurveda Day, which carries Dhanvantari, Lord Dhanvantari in the center, depicting that it is representative of the very pure holistic medicine. And surrounded there are 5 petals which symbolize the Panchabhutas, and 3 circles showing the Tridoshas, that is Vata, Pitta and Kapha. And there is an overleaf which is showing the essence of the medicine. So when it comes to this year's theme, that is Ayurveda for Prevention and Control of Diabetes, we know that it is the right and most important theme that need care and attention. The growing statistics of diabetic patients is alarming, and if you desire a change, action need to be taken from now. Unlike olden times, diabetes is now more than an old age disease. It is actually in fact affected with the very young generation, children, etc. So it is more about styling our life of traditional Ayurveda to enjoy the modern times to its fullness. So we know that through this diabetes, how this diabetes is actually became so much alarming to the present day due to the changed lifestyle, changed food habits, the too much of stress, everything actually adding to the entire community that now this diabetes is becoming a big problem to the entire community. So I think this theme which is being chosen in this National Ayurveda Day is one of the important as well as relevant. Ayurveda, we know that everyone knows in India that what is Ayurveda. Everyone has seen it, everyone has experienced, or any member of your family has experienced at least medicines or treatment, so that you know what Ayurveda. So I am not going to elaborate much about Ayurveda now. We will little bit touch upon what diabetes and how Ayurveda can help to manage diabetes. So prevention and control of diabetes nowadays, it's most important. So I think we will talk a little more about diabetes. Diabetes we know, diabetes mellitus we know that it's a group of metabolic diseases manifested or characterized by hyperglycemia, that means high blood sugar, due to the lack of insulin, or it's an absolute lack of insulin or a relative deficiency of insulin. So this is how it is happening. There are we know that diabetes, there are 2 types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes, there is always total lack of insulin. That means the beta cells doesn't produce, or even beta cells get distracted in the pancreas, and total lack of insulin will be there. So we have to supply insulin to actually convert to lower the blood sugar or to maintain the blood sugar in the bloodstream. And type 2 diabetes, we know that it is the relative absorption of insulin becomes less, that is insulin resistance will be there. And we know that after some time there will be the lack of production of insulin also will be there. Type 1 diabetes usually it's manifested with more of children or younger age, and type 2 usually manifests at usually above 40 years, but nowadays it is coming down to maybe 20 or 15 because of our lifestyle and other diseases. So that's it. That is all about diabetes, and in Ayurveda we call it as prameha. Prameham will be of different types, and that means there are 20 different types of prameha is being said by Ayurveda, and there are different versions. And the Vagbhada says 20, and in Charaga there are 2 types, and then Susruta also says there is we call it the diabetes with a lean body we call as Kasya. With the diabetes, and with this, there is Thaulia diabetes with who has an obese body, and also there is an explanation that diabetes with due to the inherent or through genetical kind of thing as the Sahaja Prameha, and due to our lack of lifestyle or difference in the lifestyle, we call it as Apatya Nimitta Prameha.
Doctor, you had mentioned about diabetes in children. So what are the symptoms that we can find the child is suffering from it?
Yeah, for children, I think we have to be very careful. That means excess urination and too much of hunger, that increased hunger, increased thirst, and maybe increased sweating, and there will be maybe the fatigue or the children will be tired, and we know that it should be much more careful when we deal with the children, because we may not be always able to identify. The most important thing will be the too much or excess urination, as well as the increased thirst is one of the main things which we can diagnose that, or we need to do a test, or we have to take the children to the doctors, then only we will be able to understand.
Okay, a viewer, Fatima, has asked, can home remedies be helpful in controlling diabetes, like using turmeric or bitter gourd?
Yeah, see, when we come to the medication part of diabetes, we should be knowing that how we can manage diabetes as a whole. Especially for type 1 diabetes, insulin is a must, that we have to provide insulin. But for type 2, usually what happens is insulin is there, but it is not properly get absorbed into the streams or into the body. So there are 2 approaches how we can actually increase the production of insulin, and also how we can actually make insulin to be get absorbed into the tissues. So here the role of Ayurveda, there is a great role for Ayurveda, that means Ayurvedic medicines, which is not only just medicine, it is Rasayana medicine. So that means it is good for the body as a whole. It actually helps to make insulin to get absorbed into, so it can avoid all the insulin resistance. There are a lot of remedies. There are a lot of medicines being said in the Ayurveda text, as well as practiced medicines, where like what you said, curcumin. If we make curcumin as well as Indian gooseberry, that means we make it into maybe something into 15 grams and give it in the empty stomach in the morning. It's very good. Apart from giving medicines or like curcumin or this Indian gooseberry or bitter gourd, everything juices, I think we need to take care about the other factors which is actually driving or which is creating this kind of diabetes, like exercise. There should be a regular exercise should be there to maintain the blood sugar level, because the energy being utilized through the muscles, and so that the blood sugar can be reduced through that, and also the body gets strengthened out of it. And a very good lifestyle, that means we call it as patyahara, that means the food which is of low glycemic index, and has to be given, and we need to have a proper dietary mechanism or a dietary practice with respect to the dosha also. That means we have to reduce the carbohydrate level, and overall the food which should carry low glycemic food items. And as Asians, we know that our earlier practice was our entire diet. If you look at the percentage, it was more than 70% earlier. So I think when it comes to the treatment, or when we are actually managing type 2 diabetes, I think we have to bring down the carbohydrate percentage to 40. And if not 3 times food, it can be maybe 6 times or 7 times food with a reduced with low calories, and so that we need to have a patyahara pattern, that means a balanced diet for the thing. Then there should be a proper exercise, and also the medicines will give a very good results.
Okay. How diabetes differ for male and female?
Yeah, this is an interesting question. That is, there is a shocking revolution that means there is a study done in 2007. That is the male. That means the lifespan of male is comparatively better than that of female. That means the women who get diabetes suffer much more than that of male. That means it was somewhere around almost 8.2 years their span has come down while comparing with a male with a 7.5 years. That means maybe the reason, the physiology maybe because the men and women, the physiology may be different. At the same time, maybe the lack of attention, because a male may be getting better attention than the female. Maybe the reason. Yeah.
How is diabetes managed?
Yeah, diabetes should be managed, can be managed very well with the help of Ayurveda. That means Ayurveda definitely talk about the good lifestyle or a positive lifestyle. We know that type 2 diabetes can be managed well with Ayurveda. There are good Ayurveda medications are there. At the same time, a proper exercise to be taken, and like what earlier said, that we should have a regular meal planning or diet planning should be there, and also the dinacharya as well as the ritacharya, which we call it. We actually practice in Ayurveda. That means a day has to be maintained properly with the proper exercise, proper food, and all the other things, and also the mental attitude also should be very good enough to be happy enough to maintain, because when we get too much of stress, there is always a rise in blood sugar happening. So I think a good attitude or a happy attitude also will be good enough to manage. At the same time, we need to take different levels of medicine. There are a lot of medicines being prescribed in the test. There are single drugs, at the same there are combination of drugs, and there are panchakarma treatments also being advised in the diabetes, because in especially in diabetes with obesity, we need to actually do a very good detoxification, like a shodhana therapy will be much advisable. And for the other diabetes people with lean structure, I think there also we have to build the tissues, muscles, etc. So that kind of medicine, Brihana type of medicines is required there. So a proper Ayurvedic treatment using Panchakarma therapy itself is highly useful in diabetes. And also I want to say that those who are in the pre-diabetes condition or those who are prone to diabetes, if they take a regular Ayurveda treatment, Panchakama treatment, the chance to get diabetes will be less, or we can delay diabetes like anything. So I think because we know that diabetes, it is more of affecting the vessels, blood vessels. So the accumulation of toxins will be much more in all diabetes conditions. So if we do a proper detoxification or Panchakama treatment, it will be highly beneficial.
What is normal blood sugar level and how can one know if they have diabetes?
Yeah, normal blood sugar level, if the fasting blood sugar level is much above than 126 milligram per deciliter, I think we can say that is more or less diabetic. And that is to identifying through the blood test, that means FBS, PPBS, or glucose GTT, glucose tolerance test, or if he is prone to diabetes, we can through the HbA1c, like means glycosylated hemoglobin test, we can understand whether he is or she is having diabetes. For a person to understand maybe the initial some findings, that means if he have some kind of excess urination, as well as increased thirst, increased hunger or fatigue, or if any of this kind of things actually is continuously there for some times, definitely he has to do a blood check, or he must see a doctor.
Can you specify the symptoms of low blood sugar?
Low blood sugar, that means hypoglycemia, that usually happens when we treat with insulin or some medicines. Usually those who are diabetic, the blood sugar level goes below maybe 70, 60, etc. If it falls below 70 or 60 milligram, we call it as hypoglycemia or low blood sugar. In this condition, or when it goes below, much below down, we can see the patient gets too much tired, perspiration, sweating, and even if it goes down, there will be convulsions, the orientation gets diverted. All these things happens in the low blood sugar state. And one thing which I want to say in this hypoglycemia or the low blood sugar, if you treat with this modern medicine, it is good to handle modern blood sugar, to reduce the blood sugar through modern medicine if it goes beyond 250 or etc. But when we administer this kind of drug, usually we see that type 1 diabetes or type 2 diabetes, the onset of hypoglycemia is much more, that it creates a lot of problem, or this low blood sugar status is being created through this medicine, actually creating the patients getting into too much of troubles. Here Ayurveda has a definite role, because any of the Ayurveda medicine doesn't create any hypoglycemic status or create any kind of low blood sugar level, which is one of the fortunate situation, which is one of the positive situation which we need to take into consideration. Because if you look at over a 1 year process, almost some 40 times a diabetic patient is getting into the low blood sugar status or hyperglycemia, and it is creating a lot of problems. So I think if you can manage this diabetes through Ayurveda, we can avoid this situation, because any of the Ayurveda drug we have not seen this low creating any hypoglycemic status or low blood sugar status.
How frequent blood sugar should be checked?
Yeah, blood sugar we need, if the patient is having too much of high blood sugar, we need to do a test at least once in 3 days. If it is at the acute onset, we have to do maybe in daily itself, but once in 3 days we have to do it. And those who doesn't have, or if they get into control, once in a month. And even then, when they get into fine control, I think they can do maybe once in 3 months. That is more advisable. Yeah.
What are the other diseases that surface due to diabetes?
Yeah, there are a lot of complications related to diabetes, because since it is more affected with the vessels, blood vessels. There are certain blood vessels get at one time through the endothelial proliferation. This the overall the blood flow gets affected, and also there are due to this the insufficiency in oxygenation or oxygen supply as well as blood supply get affected. We can see except bone, all the organs get affected. It actually creates a lot of problems with the kidney, it creates problem with the liver, it creates problem with the eyes, it creates problem with the nerves, and it is you can see it creates problem with the heart. You can see it is all the organs get affected except bone. Yeah, you know, you have heard about diabetic retinopathy with problem with the eye, diabetic neuropathy, that means with the nerves, diabetic nephropathy with the kidney. So there are other kind of cardiovascular diseases with heart. It is there. So it is one diabetes is one disease which actually creating a lot of complications to all the other organs. That means we have to be very careful. We have to manage diabetes like anything.
Yeah. Is there any Ayurvedic solution for obesity?
Yeah, obesity always associated the person with obesity actually is directly connected with maybe we can directly connect with diabetes, because obesity may be one of the stepping stone to diabetes, because it comes as a part of the metabolic disorders. Like one such reason is weight gain. That means in Ayurveda we say that all the toxins get accumulated as a part of the weight gain, obesity. So detoxification is one of the major treatment which we do in the obesity, where the Panchakarma treatment is highly effective, and there are other kind of treatments which we do with the medicines, and also some other kind of kriyas like Udvartana, that means powder massage, and all this can be done to reduce the weight, so that overall the body gets purified, and we can bring down the weight. As well as the proper Ayurvedic living, that means if you advocate proper Ayurvedic living, we can very well control obesity. That means if you understand the three doshas, and according to that, if we actually eat food and if we select food, definitely we can control overweight.
Yeah. We have a viewer question. It says ulcerative colitis and taking allopathic medications. She's also having borderline diabetes. Is it safe for her to take Ayurveda medicine for diabetes? Yeah,
ulcerative colitis is a chronic inflammatory bowel disease with autoimmune nature, and yes, both can be well addressed with Ayurveda medications, because certain Ayurveda medicines which we can actually there to heal the ulcerative colitis. At the same time, we can actually manage drugs. The same drugs, by selecting the drugs, we can manage diabetes also. These are all the actually possibilities in Ayurveda, because with the same kind of medicine we can actually manage both. Yeah.
How can one know that we are at risk, or what is the measure that a healthy person can take so that they don't get into the disease sector?
Yeah, it's a very good question, because it is really required in these days, because there are the risk factors. We know that there are two types of risk. There is a modifiable risk, there is a non-modifiable risk. That means certain risk which we cannot modify, that is the hereditary factor which we cannot modify that, but we can address, we can delay it. The age we cannot modify, because progressing on the age we cannot modify, and so such kind of things, genetical as well as the age factor, etc., we cannot modify. But there are modifiable risk factors are like the lifestyle, weight gain, we can eating habits, we can modify, we can reduce the weight. So I think the lifestyle changes usually directly connected to diabetes, like weight gain and other kind of metabolic syndromes. If a person gets too much of high BP, that means hypertension, we can actually manage that. If the waist size is more than 40 inches, we can reduce the size. This all will actually lead into the if the person is having very low good cholesterol, that HDL at a very low level, that we can make ask them to do the exercise, and we can correct. All this can be this modifiable risk factors, which very well can be addressed. Yeah.
Next question, I'm sure everybody is eager to know. Can diabetes be cured?
Yeah, this is a very good question. That means, according to the modern medicine, diabetes cannot be cured, but it can be well treated, it can be well controlled. So, rather than getting cure, it's all about controlling and keeping it at a normal level. That can be very well done through modern aspect. But in Ayurveda, in Kaphaja Prameha, we have almost different Kaphaja Prameha. There is Pitta Prameha, there is Vada related Pramehas there. In Kaphaja Prameha itself, there are 10 different types. So, in Kaphaja Pramehas, in our Acharyas say that there is proper cure. If you treat them well, you will get cured. But if it's Pitta related or Vada related Prameha, it's not curable. It can only be get into control. That's it.
A person with diabetes, can he or she have a normal life?
Yeah, definitely a person with a diabetes can enjoy a normal life. They can enjoy the life to its fullest. And but they have to be very careful in their diet, food patterns, and in their medication. If medication is required, the medication, as well as managing their stress and everything. So, if a person who is diabetic, if they actually manage things properly with the exercise, food, and medications, they can definitely lead a normal life, and maybe better than that of the other people, because when they are a little more careful about these practices, they can be much more, they will be much more healthier, and they can enjoy much more.
You had earlier mentioned that diabetes affects everything except bone. So can you just specify on how it affects or leads to heart disease?
Yeah, as we know that diabetes is always related through the vessels. That means it has a very good relation with the blood vessels. So there will be always some kind of deposits will be happening along with the blood vessels. That means there will be more of endothelial proliferation will be there, and also some kind of deposits happening inside in the blood vessels, which is actually narrowing the blood vessels. So it affects the blood pumping and blood supply to the heart and everything, and it affects the heart, the functioning of the heart, and it actually get problem with the heart. So the almost more than 70% of the disease affecting or the death is very well connected with diabetes for heart disease.
We have a viewer question. It says, I'm taking ginger, lemon, garlic juice. Is it okay for diabetes?
Ginger, lemon, garlic, yeah, it is okay for diabetes, but we should know that in which stage you are, at what stage of, and what type of diabetes, and how much quantity you are taking, because you cannot take too much of ginger, garlic, etc., because it actually the piercing effect of this kind of drugs is much on higher side. So it has to be taken at a very low level. That means a maximum quantity of 15 grams is okay, or if you take the juice also, it should be of that kind. And also you have to not only just taking this medicine, you have to see that all the other food habits and exercise. Definitely it is good, but you can maybe, it depends on the cases, you can select maybe different types of medicines as per the direction from an Ayurveda doctor.
So what are the Ayurvedic medicines that is good for diabetes?
There are a lot of medicines being said in the Ayurveda texts or in our entire science. There are medicines. We usually first understand the patient, the level of the patient, and if the patient requires a Shodhana therapy, the medicines follows according to the Shodhana. practices. That means there will be Shodhana, we will be doing little bit of Snehana, because we cannot do too much of Snehana treatments, but little Snehana, then there will be Svedana. And there are cases where we cannot do, in Madhumeha we won't be doing much of the Svedana therapy. There will be Shodhana, there will be Shamana therapy, there will be Sandarpanat Chikitsa, there will be Avatarpana Chikitsa. So that we will select which kind of Kriya has to be done, and along with that we will select which kind of medicines need to be given. There are different levels of kashayams or decoctions that are being said in the text. Nishakadagati kashayam, kadagati. There are a lot of it actually being selected depends on what is the nature and where the patient stands now. Yeah.
Does smoking and alcohol consumption have any effect, like cause of diabetes?
Yeah, smoking and alcohol, it actually affects diabetes. It actually affects the blood vessels. It actually affects it accumulates the toxins, and so definitely alcoholism and the smoking habits is not good. You have to stop and to save to be away from diabetes.
Okay, we have a viewer question. It says, diabetes, can it be cured through Ayurveda?
Yeah, diabetes we can very well control through Ayurveda. Only in certain cases, the initial days of diabetes or in the Kaphaja Prameha, it can be cured, except the other this particular Prameha. All the others we can keep it under control.
Yeah. What would be the suggested food habits to be healthy, or for somebody who is undergoing diabetic heritage? So, what is the food habit he or she can actually take on?
Yeah, the food habits is most important in diabetes. They have to take food which has low calorie value or low glycemic index, and for a person it will be something with average weight, it should be somewhere below 1500 calories, and the majority of the food has to be taken in the noon time, and other has to be divided in the morning and evening. Why we are saying it is in the noon time? Because the pitta will be on the higher side, so you will get a better digestion in the noon, and since the kapha in the morning and vata in the evening, it should be a very less food, especially in the morning. Usually we prefer to, there is a saying that we need to take more food in the morning, but it should be much lighter than that we take in the noon time. And we have to divide all this, the proportions of carbohydrates, proteins, fats and other minerals in a better way, like it should handle some 40 to 50% of carbohydrates and more protein and less fats and all the other things. When it comes to when we say that the food should contain more of vegetables, green leafy vegetables, and other cereals which are low glycemic index, and the cereals which we keep for more than 1 year will have a very low glycemic index. So that will be much advisable, because when you select cereals, I think if you keep it for a period of time and take it, that will have a much low glycemic, which is advisable for diabetes patients. And if you select the since we require more of water, so medicated water, boiled water is much effective in diabetes. So select some medicines which can be boiled and take it for drinking. And if you look at Patyahara in Ayurveda, that means the food which actually helpful for diabetes. If you select Patyahara, and there are certain drugs being said in Ayurveda like Triphala or some other drugs, if you combine Patyahara with this kind of Ayurvedic drugs, and if you take some kind of food items, and if it can be taken regularly, I think to an extent you can stop medicines also, and you can actually bang on your exercise and food, and you can control diabetes totally. Yeah.
But there's a trend that once you get a prescription, we tend to buy medicines online after some time. We don't consult a doctor and buy, but we take that prescription, old prescription, and go. So, what is your take on that?
Yeah, here our advice is if it is buying medicines online is good, but it should be only after a consultation. Proper consultation has to be done, and the doctor should know that what are your levels of sugar and how long it being affected. Is there any other complications? And you should be knowing that a doctor has well consulted your problems, seen the problems. Then buying medicine online, then it is your choice whether you want to buy in your medical shop, whether you want to buy in online, it is up to you. But the medicine should be taken only after a clear prescription from a doctor.
The lifestyle we maintain now is very stressful. So, is there a relation between stress and diabetes, or how can we manage in case there is a relation?
Yeah, there is a direct relation between stress and diabetes. When you are when your stress levels goes high, always the body has a tendency to manage the situation by putting more sugar or more glucose into your bloodstream. And if it doesn't have glucose at that time, I think the glycogen get converted and it get back into the bloodstream. So if you are under stress, always the body think that you want more energy, you want more glucose, and even if you take food also, this process may continue. So always the blood sugar level will be high, even if it is being managed with the medicines also. We can see there are a lot of people who have high stress having high diabetes or high blood sugar level. So managing stress is one of the most important thing in diabetes mellitus. So that means we need to understand the person properly, that how this stress is actually affecting him, how this stress is actually making a problem to him. So addressing stress is much more important. It is well said in Ayurveda that how you can manage stress. And I think if you go through the Ayurvedic way of living or Ayurvedic lifestyle, definitely you can manage stress properly. Yeah.
In case a female lady has gestational diabetes, will it affect her later life?
Yeah, diabetes, if properly managed, doesn't make any problem in the later life. But it is not managed properly, definitely it will affect the later life. So it is always important that if you are affected, early detection of diabetes and also the management of diabetes is also very much important, because maybe the initial days you may not be knowing that you have high blood sugar level, and over a period of time when you have affected with some other problems with the eye, with problems with the kidney, or with the problems with the heart, you may be sometimes, or maybe some wound which is not healing, then you may be actually identifying that you have been affected with diabetes. But I think by that time maybe it will be very late. So the people who are little overweight or with obese, even if they are at younger age also, they have to do the blood test and understand whether they are prone to, or whether they are in the pre-diabetes condition or not. Anyway, the people above 40 years must do blood check once in 3 months to see that whether they are affected with any kind of any problem related to diabetes.
Is diabetes a hereditary disease, and in case it is, we anyways will get it? So what is the measure anybody with a hereditary can do?
Hereditary, definitely it is one of the main factor which actually affects in actually for the diabetes. But hereditary can be prolonged. The reason or the chance of getting diabetes through a hereditary thing can be delayed or prolonged through doing proper exercise, this food practices, as well as the other Ayurvedic treatments, because we have treatments like detoxification therapies and other weight management therapies or rejuvenation therapies, which actually keep the person very healthier, so that this chance of getting diabetes can be very well prolonged, or even you can delay it like anything.
There's a viewer question. It says, lemon infused water, is it really helpful?
Lemon in water is good. That means it actually cleanses our body, and it actually purifies. It doesn't allow to keep the toxins in your body. So it is good. Overall, it is good, and also it is good for diabetes also. But lemon has to be taken like maybe 1 lemon in 2 liters of water. That is the and if we usually, when we say that lemon to be taken, usually people do take 1 lemon in 1 glass of water, which is not advisable. 1 lemon in 2 liters is okay, so that the quantity will be much less. It actually changes the pH, and to an extent it cleanses the body, and it is good.
We've also known that there are certain medicines that induce diabetes. So what are those medicines, or is it real?
There are medicines being said in modern medicine which actually create or it actually making problems. It is actually inducing diabetes, like steroids and etc. So I think that has to be managed properly, because in some cases some kind of medicine has to be given, and subsequently if you do some kind of detoxification therapies after this medication through Ayurveda, you can actually avoid getting diabetes.
Thank you so much, doctor, for those valuable information.
Thank you very much. Thank you.